Now we're looking at what we can do to improve the quality of life of patients, not spending time in the infusion room. Certainly during the pandemic, that became a significant issue. Melissa, can you talk to us a little bit about that and what you're seeing and where we're going with that?
Yes, well, since the development of the monoclonal antibodies in combination with the hyaluronidase, we've been able to start administering this and offering this to our patient as a subcutaneous administered combination. The brand name is Phesgo, but of course it's trastuzumab and pertuzumab in a subcutaneous formulation. The benefit for our patients being less time with us. And we know we're great people, but they have better things to do than hang out with us quite that long. So the main benefit that I've seen is for the patient just not needing to be in our infusion room. It's still on the same schedule. So they're still coming every 3 weeks, but a difference between 5 minutes for the administration time plus 15 minutes to observe the patient versus an hour and a half plus for the patient to receive it IV is an enormous benefit to patients, both in the metastatic setting where it's indefinite, but even in the adjuvant setting where it's finite, but it's still for, up to a year. So that's a lot of time saving for the patient, that patient can be picking up their kids from work, or, going to work themselves, or, the things that they would rather be doing rather than hanging out with us for as long. So that's been the greatest benefit to me, is what I've seen for the patients. But in the clinic itself, it's beneficial as well, because there's not the pharmacy mixing time for it. It's already, pre-mixed in a vial. It's just a matter of drawing up. So the mixing time is significantly shortened. And for the nurses' schedule, significantly beneficial for all of those patients to be cut from over an hour, really over 2 hours, down to minutes. Obviously, we always have a crunch for chair time and getting patients scheduled. Everybody wants to come in the morning. Nobody wants to come in the afternoon, and really being able to manage our schedule. So it's been beneficial on both ends. But again, I see the biggest benefit to the patient themselves.
And I think one of the terrific things for patients is that the whole issue of ports. When we have subcutaneous administration of drugs, oftentimes we can eliminate, ports being placed in many, many patients. And I know that a lot of my patients are so happy about that. Especially when, can I take a port out, after I have my neoadjuvant chemotherapy with my surgeon, and that's an open question when it's in the adjuvant setting, because you don't know if you're going to transition them to a drug if they have residual disease. But I think the port issue, especially in our patients with stage 4, especially de novo, becomes an issue. And it's so nice for me to be able to say, well, I've got this injection that you can have. Do you find that nurses are comfortable with the subcutaneous injections? They certainly use it in other subtypes of cancers, liquid and solid.
I think they are. I think it's freeing for the patient, and of course the clinic as well. I mean, I just had a patient yesterday who said to me, what I love the most about this is that I can go for walks, and in the summer I'm looking forward to be able to gardening and not having to be here for 6 hours and waiting for pharmacy to mix the drug. So, I mean, you're really talking about a 5-minute administration time, maybe they're here for 20-30 minutes. It's been a beautiful thing. I think the nurses are really comfortable with injecting it. I think the only thing that we're seeing is maybe a little bit of injection site redness. I did find that some patients felt like they sometimes would get some arthralgias like right after the injection, but besides that, it's been really well tolerated. Not having the port is beautiful. I mean, you don't have to have a procedure done, and a lot of patients, like you said, they're eager to get their ports out. One less thing in the body, and of course less risk for infection, right? Anytime somebody has something indwelling, we like to take it out. So I think it's been a great benefit.
I had a patient that came in to see me. I have a patient, present tense, that came in to see me about 3 weeks ago. and she is a stage 4 de novo with a breast that was completely replaced, with the disease tracking up to her neck, under her arm, on her upper abdomen, with a huge liver. 90% of it was replaced with cancer. Her bilirubin 3.1, transaminases that were near 1,000, but she was HER2 overexpressing. And I gave her her first shot of Phesgo a week ago. And she came in today, her Billy had dropped down to 1.3 within 7 days. Now, that's not a reflection of a subcutaneous injection. That's a reflection of the anti-HER2 antibodies. But in somebody who had neglected or denied the evolution of their stage 4 disease, who was fairly mistrustful of being in an infusion room and so on, it was such a wonderful celebratory thing to be able to just do something so easy last week and see the results of it. And now she's going on weekly Taxol with it, Andy, thanks to you.